Please welcome Dr. Dawie.
There we go. Thank you very, very much. That was lovely. There we go. Thank you. Right, folks, late afternoon session, right? Hopefully we can keep it a little bit more upbeat and lekker and keep the oaks awake and all that kind of stuff, right? As I was introduced, we're going to chat about clear aligners, hopefully some smart, simple, cost-effective ones, because that's always been my issue with them. Right, just to give you a bit of background, I come from a little town called East London, Slummies, right, out on the near Transkei coast. And the reason I look this young, even though my introduction made me sound very old, is that we live where that is. That's about, as the crow flies, about 1,000 meters away from my practice. Okay, I'm actually 94 years old, and if you really want to stay young, okay, come down to our part of the world. Look at Dr. Stradom. I mean, he doesn't look a day over 20. Okay. Right, clear aligners. Okay, what's the whole thing and what's changed and all that kind of stuff? Little aligners have been around for a long time. Okay, we've used little trutanes and all that type of stuff. And what's really changed is that we became digitized. Okay, it was easy to scan stuff. It was easy to get them into a PC. Some really nice software came along, and we could start adding tags onto the teeth. So rather than just putting a slide force onto them, we could actually put some grip onto them and get these teeth moving. The big changes are that combined with all the other stuff, all right, in my practice especially, we got to a point where we could really get rid of a lot of the wire, okay, and the braces and the brackets and all that type of stuff, okay. And these cases can go from really simple, okay, we call them level 1 cases, 6 anteriors, that type of stuff, to fairly complex cases, and if you've got a few minutes, I'll show you 1 or 2 of those, okay. But they really have made acceptance of treatment a lot easier. Okay, to me, that's really, in all honesty, been the nicest part of clear aligners, is that I'm finding that even the kids will accept certain levels of treatment a lot more often and a lot happier, all right, if I can say no brackets, no wires, okay, no brass, okay. This is a lovely young lady. We'll show a little bit more of her in a sec, okay? But you can see on the lower picture, on that lateral, there's a little tag, okay? And she was one that came in and really wanted, well, let's be honest, her mother really wanted all sorts of stuff done, and she really was not into it. Compliance, very, very low, all that type of stuff, okay? And we got with orthopedics, okay, down to the bottom picture, and we can now finish her with a little tag on that lateral, back into a really nice smile, okay? And a fairly cost-effective one at that, okay? The process is relatively simple, okay, but I put simple in very, 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 very strong inverted commas, okay? You have to stick to basics, okay? All the basics about ortho, all the basics on orthopedics, all the basics about facial structure still stay in place. This is not a quick cure miracle, okay? It's a lovely tool to work with, but it's not a quick cure miracle, okay? Just as a quick declaration before I forget, okay, I've done a lot of work with the Smiler Line guys, Metal Free, which I thought was quite appropriate, okay, but I'm not associated with them in business or in finance or anything like that, so everything I say is my opinion, okay, and not something that's paid for, right. We start with diagnosis and case selection, and I'm going to show you 2 because these 2 cases are very similar, okay, and the one's a great case and the one's a terrible case, okay. This is obviously the terrible case. All right, this is a 60-year-old gentleman that came in and he wants to be pretty, okay. He wants his smile fixed, okay. And he'd heard that we do all sorts of stuff with aligners and stuff, okay. And he thinks that if we put aligners in his mouth, okay, he is going to walk out with a great smile, okay. And it took about an hour of free time to convince him, all right, that is not what is going to work, okay. This is a typical terrible case, okay. In all honesty, this is a case that I referred to a colleague for the rest of the treatment as well. I can see the headache coming, all right. Okay. This is a 60-year-old lady, okay, that came in, right. She's been with the practice for a while, okay. She's the most compliant person you've met in your life. If you'd ask her to do anything, she'll do it immediately, and she'll do it 3 times rather than once, okay. This is a great case, okay, for clear aligners, right. And it's the type of case that goes slowly because of age and stuff like that and things you've got to keep an eye on. But she just wanted that one central straight again, please. Okay. And we've got to stick to basics and think about your case selection. The other thing about case selection and looking at the patients is, please, if you use these things, make sure that they understand what they're getting, okay? It's a pitfall that I walked into with my eyes beautifully open, explaining to folks what we're going to do. They only want their 6 anteriors done. And what's happening at the moment with these things is that people that normally would have gone and had their 6 anteriors cut to pieces and porcelain put on, okay, because they don't have to wear hardware, all right, are opting for longer treatment. They're actually saying, fair enough, I'll go through orthopedic treatment for 6 months, and I'll go through the aligners for 6 months to get the result, right, rather than having my smile cut to pieces. But there's no way they would go for brackets and braces. Okay. So make sure that they understand what they're going to get. If you're doing a level 1 case, which is just the anterior 6, it's purely an aesthetic case. You're not looking at function, right, all that type of stuff, okay? Make sure the patient understands it's the front 6 teeth, okay? They're here aligned, right? And when you've got the front 6 teeth beautifully working out, and it's so lekker, and you chuffed, and you show them the result, and they go, but I don't know this tooth. Okay, and this one, okay. I mean, we've all got those clients. They're lovely, all right, but they're nightmares, okay. Please make sure that they understand what they're getting, all right, and make sure they sign for it, okay. What's the process, okay? And the process, again, as I said, is relatively simple, but it's got to be done right, okay. If we have a look at how it starts, okay, it all starts, as I said, with a diagnosis, okay. Once you've made your diagnosis, okay, things start speeding up, right. Impressions are absolutely vital. They've got to be really, really, really good, okay? It has to be a rubber impression. Do not try and think that an alginate is going to give you the result that you want, okay? Every time we had a mishap in the last year, and I blamed the poor technician for it, it was an alginate that I sent him. Okay, it's got to be a rubber impression. The scans are just better irrespective of what you're scanning them with, okay? If they're being cast and sent off to the laboratories, the casts are just that much more detailed, all right? An idea that Zarius came up with now to start, especially when people are far away, to make sure that things are actually right, is to actually cast them twice and use the second cast to make a local little Trutane or clear aligner and fit that first to make sure that you've got that impression right, okay? And I'll show you what happens if the impressions aren't right. They do catch up with you. Okay, so the impressions are made, scanned, digitized, whichever you want. You can put them onto a cone beam CT for those that you've got that have, okay? The cone beam scan impression trays very, very, very well, okay, in high detail, all right? Your labs, with the milling labs can scan them, okay, or you can send them directly to the guys, okay? You have to write out a prescription. What do you actually want, okay? The poor technician needs some idea, okay? Right, goes off to metal-free, okay? And then they start playing with it, all right? And this is actually that little lady I showed you, all right, with the front tooth. And everything gets built in on the software. That image and those details then get shared with you, right? And pretty much any way you like, okay? Pictures, Skype, video sent over. It's, these days with communication, that's really not a problem at all, okay? And then the stuff gets, the little models get printed, okay? And this is where the costing needs to start coming in, right? This is where you chat with the lab and get more details about costing, okay? Because depending on obviously how many of those little models need to be printed, okay, it'll depend on where your costing starts going, okay? In general, if you're looking at just a finisher, okay, you've got a tiny little tweak you want to do after you finish treatment, okay, it's 1 or 2 models at the most, okay. If it's 6 anteriors, you're probably looking at 5 to 6 of those, okay. And as the cases grow, obviously there's more and more techniques, okay. The models are printed, okay, they're sent off to you, the aligners are pulled over them, okay, and they're sent off to you, and you arrive in a nice, beautiful box, they're numbered, and you start going, right. Not all the aligners are sent straight away in the big cases, right? Because you want to make sure that everything is going the way it should. If you get to aligner number 5 and everything is cool, right, the rest of them get sent. If you get to aligner number 5 and there's a little bit of discrepancy, you take another impression, get sent off, the corrections get made, and the rest of the stuff gets sent. Okay. The one thing that is nice, okay, is the visits are fairly simple, right? The patients come in, you check, you look, make sure that your current aligner is fitting passively, otherwise you don't know that it's done all the movement, okay? You change aligners, and the patient goes off again. in my hands, I find that the patients don't have anywhere near the level of discomfort, okay, that they would have when we've changed or tightened their braces, okay. But I have had colleagues say, oh, hang on, no, that actually hurts more, okay. So we'll have to see where that goes. Okay, critical items. You've got to get your diagnosis right, okay? Please, please, please. It's not a quick fix, okay? You still have to go through the process. It's a great tool, but not a quick fix, okay? Make sure you get patient consent. And then, as I said, impressions, 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 impressions. This is typical of a case, okay, that we sent an alginate, okay, instead of a rubber, okay, and a slight discrepancy ends up in a big discrepancy. And if those things don't fit properly, the anchorage isn't there, you don't get the movement you want, okay, and things go south fairly quickly, all right? And then the costs start going up. Okay. As I said, the beauty is that the software's got really clever, okay, so the nice thing is when you visualize these things, okay, you can sit and discuss this with your patients and show them. It does help with acceptance, all right, but it also gives you a really good idea of what you're going, okay. And where things are sitting, if you're sitting with a really, really big case, I was chatting to one of the colleagues earlier on, right, is that you can do all your planning with the CEFs and the modeling and the whole works, okay? And once you've done your planning, you've decided clinically where that case should go, all right? If you then share that information with the technicians, all right, they can then do their modeling, okay, according to that, and you can get a really good visualization of what your case is going to look like at the end, okay? Just some more visualizations. It's really nice to have, okay? Click, sorry. There we go. Here's our little lady again, just to give you an idea, okay, of where these things can go without having a bracket or a piece of wire in the mouth ever. Okay. Right. That's an idea of the software, and this is where the nice parts come in, all right? I don't know how many of you have tried Kessling setups or where you cut these things apart and try and put them together and stuff like that. On bigger cases, it becomes hairy about how much do you change each step and stuff like that. Then we try them once and we just don't go back again. In this software, there's a whole range of parameters that's built in. Okay, just how far can you turn a tooth? Just how far can you twist it? Just how far can you pull it? Okay, so that you get all those right steps in place before you start going, all right? And it makes your treatment in the end a lot easier. Okay, and then just some odd cases, right? I told the folks I'd make up time. Right, a lovely lady came in, okay. Her main issue was that she actually wasn't happy with that 2-1. Okay, that was really the big thing, okay. But if you started twisting and turning, there wouldn't be enough space to get it in. She did not want stripping, okay. She actually originally came in and said, can you please give me 4 veneers? Right, this is not a 4 veneer case, okay. Little bit of expansion, okay, it took about 2-3 months, okay, and the aligners, and we're now at a point where we can go and do those ugly composites on those 2 anteriors, okay, well, 3 anteriors actually, and we can get going, okay, and she's happy, okay. Same thing, younger patient, wants things smiley, okay, matric dances coming up, all that kind of stuff, but just does not want to go into braces, okay. And a fairly straightforward, easy fix, okay? And there are mistakes in there. We've got a premolar that's sitting out. It doesn't move the other stuff, but we've got a patient that's happy with her smile compared to where it was, okay? The interesting with this young lady is she's now 19 years old, okay? She's now come back and said, can we fix the rest? Okay, and that's a very nice spin-off. People get into the idea that they can, there's more to it. And once they get used to it, they get going, okay? And then just as a quickie, these things work really nice in complex cases as well. This is a lady who's the wife of one of our specialists in town, right? And she came in originally for aesthetics. Okay, we started chatting to her. Okay, the whole thing with her migraines came out. Okay, we then had her off. Okay, to one of my chiropractor buddies. Okay, found all sorts of issues in her neck that was connected to the migraines, that was connected to the TMJ. We then started getting into splint therapy, okay, and she came to me and said, you know what, I'm actually relocating in about 6 months' time. Can we get the top of my smile right at the same time? Okay, so it can be combined. It's fairly easy to combine with other treatment, okay. And in all, that is the whole story on clear aligners, okay. It's a great tool, okay. It doesn't change your diagnosis, it doesn't change your treatment planning, okay. It can make treatment faster, okay. In my hands, in all honesty, it makes my treatment cheaper, not more expensive. Okay, yes.
What about retention and stability afterwards if you do only the upper?
Sam, you've got depending on the case, okay, we can either, the cases where we've done a little bit of stripping, okay, if the lowers are stable, the uppers will stay stable, okay. In the cases where it's a pure aesthetic case, where there's no, where you've had to bring things out at extra little twist to get space enough, okay, we put a little fixed retainer in at the back, okay. But again, very good question, because again, your client's got to know that this is what's coming. Right, they've got to understand. One of the things that caught me on that point, right, is that I had a client come back and said, "But hang on, now I've got a little 2 millimeter gap, okay, between my top and my front teeth." Okay, fortunately, a nicer client rather than an unhappy client, and she actually went into full treatment. So it was a nice step into it. But that's the whole point. Okay, people have got. If you're doing an aesthetic-only case, please make sure they understand what they're getting. Okay, it is essential. Okay, all right. Are there any other questions? Perfect, excellent. Thanks for sticking it out. Oh, yes.
Your little 6-upper anterior case, you said you're doing lateral set. Lateral set for a case like that?
No. I'll tell you something. Not unless I'm suspecting TMJ involvement and bigger issues that aren't out there. All right. And even then, in all honesty, it depends on the client. Okay. If I discuss it with them and I say, listen, okay, you've got a trapped mandible, you've got a whole bunch of other issues. Okay. You need to have a look at these other stuff first, and they're approachable. We'll go into the full diagnostics with the CEF and the rest of it. Okay. If they're not, okay, it becomes models only. Okay, upper and lower models. Get them digitized, do the planning, and if the patient's happy with the planning, carry on with the treatment. Okay, good. There we go, folks. Thank you very much. Thank you for your time. Oh, there you are. Thank you.